I'm just going to talk about arthritis, pain relief, and medications, and some over-the-counter medications you can use, as well as what medications we use. And arthritis, by definition, is, you've seen some of my other videos, and if you think about your dog's wrist, and you bend the dog's wrist like that, and it pulls back, it could just have a sprain. But if what happens is, in dogs with arthritis, is arthritis occurs around the joints. And this is the pelvis, and this is the leg bone called the femur. And in life, if in walking around, this ball and socket here just pivots and wears and bumps. Inside, between the pelvis and the femur, is a lining of cushion. And this cushion prevents bones from meeting bones. When an animal walks and bones rub on each other, it causes inflammation and swelling in the tissues and pain. Now look at this ball and socket. This ball is nice and smooth. It fits into the socket really nicely. And if it had an overlying covering of that cartilage, it would go smooth and there would be no pain. It would be a gliding, very smooth meeting of the two bones and cause no pain. But if the ball of the femur does not meet in the socket and bumps and grinds around, then that cushion wears out and you get all this bone production as the body's trying to say, gosh, if I grow enough bone, maybe I can stabilize this. Or it's irritated, so it produces all this bone. And that's called arthritis. In this case, this is hip dysplasia, where one ball and socket is not very well formed in the beginning, and the cushions wear out, bone rubs on bone, and you get terrible arthritis. In this other case, in the elbow, the elbow is a very, very particular joint, and it's made up of several bones, the ulna, the radius, and the humerus, and it can also get arthritis in these areas down in here as bone rubs on bone, and especially dogs that jump, and it should go this way because the humerus goes up there, and as dogs jump, they bang the joints like that, and they wear out in these areas, and it can cause elbow arthritis. So all that is just to let you know that what arthritis is. And what veterinarians use more and more these days is we use something called NSAIDs. They're non-steroidal anti-inflammatory drugs. In fact, if you look at an aspirin bottle now, and you probably can't see it from where you are, but it says right under it, NSAID. So aspirin is an NSAID. It is an anti-inflammatory agent. And there's adult aspirin, which is 325 milligrams. And there's low-dose aspirin, which is 81 milligrams. Now, there's a lot of articles on the internet that says, don't give this to your dog because it will cause them to bleed to death. And it will cause an ulcer. But if you use the right dosage and you don't overdose it, and you start out with a lower dosage and see how your dog reacts to it, and your dog isn't really, really stressed, aspirin can be a wonderful temporary over-the-counter pain reliever, because maybe your dog just pulled a muscle. Maybe it just sprained a wrist. Remember, if your dog puts weight on a limb, it probably isn't broken. It probably pulled something playing, landed wrong on it, sprained a joint, pulled a muscle, and maybe 2 or 3 days of an anti-inflammatory like these will really help. So everybody says to me, they email me all the time, that my dog hurt itself, what do you think? Well, of course on an email it's almost impossible for me. I have to put my hands on the animal and watch him walk, but just for you, if your dog's walking on a limb, if it's putting weight on it, and you've checked all the way up and down the limb for wounds and stickers and cuts and scrapes, then you can wait a couple days and see if it's better. You can use aspirin. What's the dosage? Well, you can go to Dr. Greg's 11 Practical Home Remedies at dogdishdiet.com and you can get a free download of the dosages. But I'll just tell you here, baby aspirin is good for small dogs and medium dogs. A baby aspirin, usually you want to use 5 to 10 milligrams per pound. Now this is where the math comes in, this is where it gets scary. So if you had a 10-pound dog and you said, well, I told you, I'm always going to tell you to start low. So 5 milligrams on a 10-pound dog would be 50 milligrams. This is 81 milligrams of a low-dose adult aspirin. We used to call them baby aspirin, but they don't call it anymore because we don't give aspirin to babies because of the Rise syndrome and all that. So now it's low-dose aspirin. If you gave half of a pill twice a day to a little dog, then and then you, after a dose, you say, oh, okay, it's not vomiting, there's no diarrhea, there's no problems. So you give them another dose that night, and then the next day maybe you give them one dose, and that's probably all you need for most temporary treatment of lameness. So that would be on a small dog. You need 1/2 of one of these for a 10-pound dog. You need one of these for a 20-pound dog. So, and onward and onward, you could give more and more of the low dose if that's all you have. Now the adult aspirin, the 325 milligrams, you would give 1/2 to 1 of these for a 30-pound dog. So you start out with a low dose, make sure that they're okay with it, and then you could repeat it that night or the next morning, whatever the case may be, and then the next day. And you could do it 2 or 3 days. Remember though, you have not diagnosed anything, and it may be an infection, and it may be a small chip off one of the bones, probably not a break, because if it was broken, your dog wouldn't walk. And don't give this to cats, because cats are very sensitive to aspirin. So that's what you can do over the counter. Now, if you do go to the veterinarian after giving aspirin, your vet might say, well, you gave aspirin, so I'm not going to give another type of NSAID. We're going to wait a day or two or a week. So, but for most temporary things, you probably won't need to see the vet anyway. So if you give aspirin, either the low, see I call it baby aspirin, but low dose aspirin or adult aspirin, you may not have to see the vet because it might take care of it. But if your vet recommends an NSAID, remember to tell them that you gave aspirin, because on occasion, rarely, dogs that receive one of the other NSAIDs, after they've taken the aspirin, can react with an ulcer or bloody diarrhea. So it's important to know that. And what is an NSAID? An NSAID is a non-steroidal anti-inflammatory drug. And there's several types. Aspirin's one type, we already talked about that. The ibuprofens are another type. But you can't use this type of ibuprofen on dogs because they don't react to it well. So this is another type of, another class. And the ibuprofen drugs are what all the veterinary drugs are modeled after. So we have Previcox, we have Rividel, we have Duramax. I want to make sure that you know that if you do use any of these NSAIDs, if your dog vomits or it has diarrhea or it looks like it's not feeling good, don't use, just quit giving them. And your veterinarian and you can come up with something else that might help. So that's the veterinary NSAIDs that we use, or non-steroidal anti-inflammatory drugs. And another one, it's anti-inflammatory, is fish oil.
Well, this fish oil works by decreasing inflammation. If you look on the chart there, you'll see EPA. The EPA goes to the left side through a cyclooxygenase into a healthy prostaglandin that's actually an anti-inflammatory. So if it makes more of that, then it protects the cells with that anti-inflammatory, whereas The other omegas, the omega-6s, lead to inflammatory products and pain products that cause inflammation in cells. So that's how it works. So fish oil is actually an anti-inflammatory drug. It's a good reason to take it.
So that's fish oil. So you can give one of these for a small dog 3 or 4 times a week. I give my big lab 2 or 3 of them 3 or 4 times a week, and medium-sized dogs can get 1 to 2, 3 or 4 times a week. I don't give them every day, but I try to keep them out on my counter and give them to my dogs at least 4 times a week. The reason why I use fish oil is because it helps nourish the skin better, and it also is an anti-inflammatory. Helps the bones, helps reduce the amount of inflammation you get from wear and tear on the bones. Antioxidants have good anti-cancer properties, so I think it's really a good overall drug to use, fish oil. So that's the anti-inflammatories we use. This is another anti-inflammatory we use a lot, prednisone. It is a steroid, so it's not part of an NSAID, it's non-steroidal. But when the anti-inflammatory, the NSAIDs, don't work as well, we sometimes use prednisone for advanced arthritis or painful arthritis, and we try to use it every other day if we can. But it's a really great drug to use as long as you use it judiciously, not a whole bunch. And sometimes people even use it off and on. We call it pulsing. So you use prednisone for a week, and then let the animal rest for a week, let the organs rest, and then you start it up again in a week. So there's lots of ways to use prednisone. It's got a nasty name attached to it because everybody relates it with side effects. But really, truth be known, this group of drugs also has a lot of side effects. So it can cause ulcers, it can cause bleeding problems, rarely in dogs. Same with steroids. If you use a whole bunch of steroids all the time, it can cause problems. But used sparingly and when you need it, it's a great drug too. What do you do with the kitties in pain? This is one of our kittens that, well, somebody dropped 9 of them off on our doorstep, and this male's brought in 6, and we're trying to adopt them out. Are you painful? No. So cats can get painful a lot because they get cat bites. They can also get sore backs from getting in fights, twisting and turning. So, but you can't use aspirin on cats. And really, there's not a lot of pain relievers for cats. There used to be a drug called meloxicam, and it's been you can't use that for cats anymore. There's a new drug that's only that's an NSAID, and it's only really for cats after surgery, and it's called robenacoxib. I know it by Onsior, but that you can use that post-surgery in cats. What we usually use all the time is cortisone. We use prednisone for pain relief in cats because they seem to tolerate it real well, and it's a really good pain reliever. So remember, don't use aspirin in cats, don't use Tylenol in dogs, don't use ibuprofens in dogs or cats, and really you can't use much of anything in cats, I'm sorry to say. Your cat's just going to have to wait till it goes to the veterinarian unless you have a previous dosage of one of the NSAIDs or pain relievers for cats, because they just aren't very. Cats are sensitive, much more sensitive to the drugs than dogs are. And if you want a cat, no matter where you are in the world, please come to Gilroy Veterinary Hospital and adopt. We have 6 more. Don't you want a home, or is this good for you? No, I'm not going to take it. I already have 3 cats and 3 dogs. That's enough for one house. So anyway, just thought I'd go over all that. I know it was probably boring, but you know, some things aren't all that exciting. So have a good day, and if you want to, check out Dog Dish Diet. I get clients that come into my practice here all the time saying, thanks for telling us about keeping our dogs off wheat. Thanks for letting us know about how to home cook food. Thanks for letting us know what dog foods are best, because it's made a great big difference in my practice. It made it more fun. I can actually be preventive. instead of using all these drugs to treat stuff that sometimes nutrition will treat. So check it out if your dog's got itchy skin, itchy ears, seizures, bladder stones. It's always one of your options. Have a great day.